We know that our community in particular suffers from this epidemic of poorly treated chronic disease, in particular diabetes. We know that access to care is limited in the community. And so there are a number of reasons why this is so prevalent in South Los Angeles. One of the most important reasons is the socioeconomic underinvestment that's occurred in communities like this. So there is often a paucity of healthy food choices for patients. Because of that, part of our program has been the ability to give access to good quality, healthy food and nutrition, along with education on why it's important. That's been an important aspect of this multifaceted, multidisciplinary approach to diabetes care.
Thank you all so much for coming out and participating in the class and giving me an opportunity to make everyone aware of eating healthy.
Vengo porque yo tengo alta presión, tengo muchas cosas enfermas, tengo diabetes. Entonces este programa me está ayudando mucho porque nos están enseñando a cocinar saludablemente para ver si nos ponemos al día también con la dieta.
So the Diabetes Management Program is one that's been established to address a lot of the underlying problems that we see in this community. So we have the highest prevalence of diabetes in all of LA County here in South Los Angeles. So to address the diabetes epidemic that we have here, we have a very robust multidisciplinary program that involves nurse care managers, it involves diabetes educators, it involves the primary care physicians, community health workers, pharmacists, and the specialists, the endocrinologists, the wound care specialists, the podiatrists, the vascular surgeons, etc., that are all working together to treat patients with diabetes and who have complications of diabetes.
She's very familiar.
So how have you been doing?
I've been doing fine.
How's your blood sugar been doing? Have you been tracking it?
Yeah, everything's fine. My A1C is down and everything.
Oh, that's excellent. That's excellent.
Yeah.
It's recommended by the CDC that diabetics at risk of amputation see their podiatrist once a year. We go above and beyond that. I see my patients at least once every 6 months. Those are risk factors, usually every 2 to 3 months.
Before I came to MLK, I don't believe that I got adequate care. And that happens all the time. I've experienced a lot of that. But that's why I felt comfortable with Dr. Hall right away, because he explained to me my situation and what could happen and what he was going to do to help me. So I felt comfortable with that right away.
Comfortable? So with diabetes, you can develop neuropathy. So you won't feel little scrapes and wounds initially because your blood vessels are so damaged. Those small wounds and cuts can develop into bigger wounds, which can also lead to amputations at the end.
So wound care is an important aspect of having this multifaceted approach to treating patients who have diabetes and to prevent further ongoing complications or progression of their disease.
When we get a wound, say in the hospital or the clinic, we can immediately get them into the wound care center and get them the type of care that they need.
I think most importantly is keeping patients from being hospitalized and no amputations. You know, if we're following up with the patients and checking on those wounds every week and measuring them and making sure that they're not getting worse, that keeps them from being checked into the hospital.
Are you doing okay with the hyperbarics? How do you feel?
Good?
You feel good? Are you having any pain?
No.
All wound care should be standard. That's where the essence of what we're trying to do here at Martin Luther King Healthcare is bring the standard of care here to the level that meets all care everywhere.
I think what the evidence has revealed is that what we're providing here, and I think what the program is really asking for and demonstrating, is that what is required is not more than what is needed in more affluent communities or people with better insurance. What it's asking for is essentially the same level of care, the same level of access, and the same high quality approach to treating their conditions.